Hello and welcome. This is Dr. Jerry Cuomo. I'm here with another rescue case. My patient's been waiting now for about another 10 minutes during what we call the pre-soak phase. I'm going to go ahead and zero in on this area and show you what we have, the history. This is fourth part of a series. And so we've had prior access by two other dentists, once a specialist, once a GP. And the problem was a loose crown. The next problem was try to understand, well, where did the loose crown, what was the problem? Well, we found out that there was definitely a fractured screw. This is an abutment screw for this particular type of implant. Now, we might guess that it more than likely is like a Zimmer or a Biomet. Right, this is the internal aspect. The hex head, internal hex, along with that of the screw type, so the screw thread type. If we look more closely, we can probably assume that we're dealing with close to 7 or 9 threads. I'd have to sit here and count them, but to know that is probably not as important to know that there is a screw fragment in there, and whether it has the capability of coming out or not is the question. We know there's mobility. Let's take a look. All right, here we go. Right now I'm about 3.2 power right now. I'm going to go in, now I'm going to go up to 5 power with the microsuction coming. And now you can start to see the thread. There's some threads in there, we can see that. Okay, so here we go. Microsuction's important. And now we know there's definitely a pattern to the fracture. We're not past the first thread of the implant yet. We soon hopefully will be. We pre-soaked this several times, just to let you know. As we did, we kept moving the fragment slowly. Now we're knowing that the clockwise rotation is really counterclockwise through a mirror, so it's just the opposite. So now we've definitely got some more movement. Another turn, another complete turn, and we're off and running. Here we go. Let's check this again, make sure. Okay. That's the turning. Okay. All right. All righty. Okay, so it did stop again. You see how it did turn and then it stopped again. So again, we're going to pre-soak that again. If I can get it to turn anymore. Well, it's not quite coming. So there could be some damage to the threads where the fracture occurred. So that's what we need to soak. Again, tartar and stain, a little lubrication together, back inside. Looking to get that final movement to get it over the top. Seeing little bits and pieces maybe of some metal too. See that right there? So that I picked up in there. See, that could be something that causes the screw, inhibit its removal. So we picked those things up, right? And we just continue to use new brushes. My dental assistant's anticipating now. She's going to get me some new brushes to continue our treatment. She's getting them now ready for me, all ready to go. Again, there's definitely some cloudiness. We'll go ahead and use the vacuum on that. It could be just some simple debris. Here's the vacuum now. See if we can get some movement here. Again, it's clockwise, counterclockwise. This would be clockwise. Let's go back and get some reverse. See, we get the washing machine went over here back and forth. And one more leap. Yeah. All right. Let's just load it up with some oil and see what happens. Out. Try it again. Right to the top, guys. Almost got it. Oh, I love the way that thing turned. That's nice. Let's soak it again. We're going just purely now with machine oil. Handpiece oil works great for this because you've got some cleaner in there. And why not? Clean as we go, as we say, right? Clean as we go. Okay. Check in for mobility. Okay, so this it may be a good point now because we know the abutment can come right off with no problem. Might be a good time to take the crown away. It should pop right off. Get rid of the scaffold, get the crown up. Let's go with microsuction again. So you're probably reading my mind. We'll have better access and we'll actually see, you know, what's the stubbornness. Although we made it through the next pitfall, we're right at the cusp tip now. We're right at the top. My feeling is that the abutment is holding it now. I could be wrong on that, you know, but that's my feeling. Let me just see. Yeah, it's stationary now. We have a thread and a half to go. No, actually the top is just right at the top. So there may be a little change there. All right, so let's do that. We're going to take a little time out. Dr. Jerry Cuomo, a series here of videos to undergo, but again, we're going to remove the crown by just removing the blue scaffold, the composite blockout material, and then we'll come back and look at it again. We're going to put the crown in a cleaner as well. See you in the next